Hello, welcome to Adapt NCLEX, and thank you for deciding to watch this video. You want to learn how to answer questions, strategies, and then comfortable with the NCLEX practice questions, both for the new generation and then standalone questions. Let's try it. I have 10 questions to test your mind. First question is a mini case from Next Generation like. So the EMS brought a client to the emergency room with a new onset buzzword. There's a new onset of what? Confusion, headache, and lethargy. The BMP revealed a sodium of what? 123. The nurse should suspect side effect of what? Break it down, right? If I come in all of a sudden, I'm confused. I have headache. And I'm lethargic. And my sodium is 123. What do you think? Something is related to low sodium. This is how you break down the question. The buzzwords and that. So they have to be interconnected. That means sodium is responsible for all of this. Then you look at the answer choice and said, which of these will cause sodium level to be low? A Bordereau has nothing to do with your sodium. It's for bronchodilator. Stool softener, he make you poop, right? The thiazide is a calcium channel blocker. It does not affect your sodium at all. All it does is a vasodilator. It improves the venous capacitance, and that's how it decreases your blood pressure. Hydrocodone make you constipated. It can drop your blood pressure. I don't have anything here. It can drop your respiratory rate because it's an opiate. It can give you urinary retention too. There's so many things about this medication, but it does not cause confusion. Even though it make you drowsy, it does not cause headache and no lethargy. It does not even drop your sodium to 123. You left with one answer there. That's how you do questions. Even if you don't know, go for the wrong ones and you realize that, oh, by using your keywords. Okay. Now, we know this is the problem. So part 2, chlorothalidone was the offending agent. Select 5 interventions the nurse should prioritize for this patient. What do you think? You came in with confusion. You're lethargic, right? And you have headache. And your sodium is 125, right? You see 125, I think 123. Hyponatremia, what is your normal one problem when somebody comes with hyponatremia? What is the side effect? Number one side effect you should pay attention to. You think about SIADH. What do you do with them? When they come in with the hyponatremic, what do you do? The major problem for this is seizures. So this guy is going to be in seizure. So we have to protect for them and correct their sodium. To correct hyponatremia, the sodium is less than the normal. That means you cannot give them anything less than 1%. So your fluid should not be less than 1%. It has to be greater than 1% or 1% or above, but mostly greater than 1%. Therefore, this is 0.5% negative, 3% excellent. If they're going to have seizures, the bed in the lowest position. If they're going to have seizures, I'm going to have suction at the bedside. If they're going to have seizures, all side rails should be up. If they're going to have seizures, I'm not going to give them food. If they're going to have seizures, side rails are padded. You see what I'm doing? I'm repeating the same thing so that you guys can get used to that. You see that when you answer a question like that, you don't have to think too much. I break it down. I have my keywords. I know what I'm looking for. Every answer choice, I go back to my seizure. If I'm going to have seizure, all side rails will be padded. I don't have to keep on thinking. Test taking strategy. So those are the things the nurse need to prioritize. Next question. who need immediate intervention. Among four of them, who does need immediate intervention? I have something I call B sharp, and it's the most inclusive information that you can use to prioritize a patient, and you don't have to think that much. Just being sharp, you'll be able to find anybody that have a problem. Either it's a breathing problem, electrolyte issue, a shock or sepsis, hyponatremia. You'll find any diagnosis that you're going to be used. At the same time, being sharp means I'm looking for something that is going to kill somebody. I'm not talking about 2 minutes, 3 minutes, 3 seconds, 4 minutes, 5 minutes. I'm talking about now. What can I do in 1 to 2 seconds to save somebody's life? That is being sharp. That's all. So for this patient, look at it, divide it into two, and look at the situation. So I'm dividing this into two, like that. A 25-year-old sickle cell client. Okay, what is the problem? Receiving IV morphine. Thank you, you're doing better. A 3-year-old Kawasaki client, what is the problem? Receiving aspirin. Oh, yeah, that's what you need. You need aspirin and immunoglobulin, okay? An asthma patient and hypertension, patient receiving a 35-year-old asthma and hypertensive patient is receiving what? Atenolol. Then I ask myself, if you have hypertension and asthma, both, there's medications you cannot take. You can only take selective beta blocker. It's bisoprolol, atenolol, and metoprolol. And he's taking atenolol. I'm good with you. You'll be fine. Therefore, number 4 have to be the answer. That what is the problem? What is the key here? A 3-year-old heart failure client is requesting ondansetron before digoxin. That tells you something is wrong. Why is he requesting ondansetron? Probably he's nauseated. And nausea, any GI symptoms, no matter what, any GI symptoms, when you're taking digoxin, it's a priority. That means it's a side effect. Those are the early sign of side effect. This patient does not want ondansetron. They're getting sick from digoxin. So we need to see that patient. So that's the clue they will tell you. Any GI symptoms, it's a priority. So I need to intervene with this one. The other ones, they fine. Number 4. A nurse is caring for the assigned patient. It will be most important for the nurse to see which client first. The same thing. Who is your priority? Who do you need to be sharp about? Right? I have a divided into two again. I have multiple sclerosis patient with the Foley removed. Okay, multiple sclerosis, they have bladder problem, they have GI problem, they have urinary retention all the time. We remove the Foley, right? And there's no urine for 5 hours. What is the issue? Usually we give you 6 to 8 hours. You can go all the way to 8 hours. After 6 to 8 hours, we want you to pee. If you don't pee, then we do something about it. Put the Foley back in. Patient is in 5 hours, so I'm not worried about you. Abdominal aortic aneurysm with recent onset of back pain. Oh my God. If you have this aneurysm sitting there like that in your back and you have back pain, that means you have battery rupture. This patient is in trouble. We got to see him. Is in the B sharp, that is shock. This patient is going to be in shock if you don't do anything. Cabbage, okay, 2 days ago, and external pain when coughing. So cabbage 2 days ago, what is the problem? They have external pain and coughing. This is your chest. I crack your chest, and I go into your heart, fix your heart, and I close your chest with the wires, external wires. This is the wire. It's so thick, you can even cut your fingers. if you cough, do you think he's going to feel good? No, you're going to have pain. So this patient is good. The cabbage is not the problem. Okay? Coronary artery bypass graft, that's what it means. It's not the problem. Don't look at it. It looked like a big surgery. No, but what is the problem? Their chest is heading where you fix the wire when they cough. So you don't need to worry about it. Bacterial pneumonia, and you started 94 on room air, I will send you home. So the person you need to see is somebody with the abdominal aortic aneurysm with the new onset of lower back pain. This is how you do B-sharp. So if you don't know, just check out that NCLEX. There's a bunch of videos about prioritization techniques that you need to master. And trust me, you will love it. So check them out and see if it works for you when you're doing cases on prioritization. And you see how versatile the B-sharp is. It's very versatile too, and you will love it. Next is caring for alcoholic, and next is caring for alcoholic clients on the Med-Surg unit. Which vitamin deficiency the nurse should anticipate? This is a simple, straightforward question, but it has a lot of content. People get confused all the time. That's why I did this question. A nurse is taking care of alcohol. What are your keywords, the buzzwords? Alcoholic client. Okay, that's so. I'm underlying alcoholic client. What is the issue? Vitamin deficiency. So these are only my buzzwords. There's only two. You see, alcoholic, vitamin deficiency. And there's a bunch of vitamins you see on the board. You have to know their name and what they do. So I'm giving you the content. Vitamin B12, B2. No, let's start with the one. One, okay, this is thiamine. This is what is deficiency in alcoholic, okay? That will lead to chronic encephalopathy. This is the problem. That's why they confabulate. They have deficiency of this. Because of that, you have to give them this before glucose. When they come in, they have deficiency. So then you have vitamin. The two is riboflavin, okay? This is usually in B2 deficiency, and most patients will present with like fatigue. They will have fatigue, swollen tongue, and they will have blurred vision. Those are the side effects. Then we have vitamin D3, okay? This is niacin. This is a classic question. I'll do a question later on it. Niacin deficiency, the disease process is, we call it the pellagra. Pellagra. And what is that? The 3Ds. I call them the 3Ds. We have 3Ds, dementia, Alzheimer's, and depression. But these 3Ds is different. They look the same. These people have dementia, they have diarrhea, and they have dermatitis. And that's the way they present. It can be very dangerous. They come in with the severe dehydration and they can die from it. So anybody with vitamin B3 deficiency is called niacin. And the 3D, the story they give you, the case will be somebody with dementia is having diarrhea and you have a skin lesion. So that's what you look for. Then you have vitamin B6, the paroxysm. So that's the medication for that. And this is what you give this patient who is on INH, isoniazid, to prevent peripheral neuropathy. And then, so this is B6. And then vitamin B12. This is cyanoacrylate. Cyanocobalamin. So this is the B12. Somebody who has like gastric surgery is what you give them because they mix in that gastric surgery. And also it lead to balance problem. They have a balance issue. So 4 weeks, you should follow on that. But these are the vitamins you should know that is very testable. So I've given you all the content over here. Very, very important vitamins and the side effect. So for this question, what do you think? Alcoholic is not 2, it's not 3, it's not 12, it's not 6. It starts B1 with this timing. Number 6. What is the problem? You got to read from the back. Which information will be the most concerning to the nurse as she interview the client before honoring the orders from the physician? So something the nurse should be concerned before checking the orders and making sure they can give the prescription or whatever they need to. A female client was admitted to the hospital, right, for depression. Evaluation revealed their blood pressure is very high, 150/70. Decision was made to start therapy with enalapril. You got to know this. So which information from the history that the nurse obtained that require to take a pause before giving this medication to the patient? So I have a patient whose blood pressure is 170. I'm about to start enalapril. Which of this that should let me have a pause? You see how I break down the question? So that's all. These 5, 6 lines, I already use 2, 3 ways. Hypertensive patient, I'm going to give it enalapril, and she's a female. I can put a female there. What should I worry about? Then you say enalapril is ACE inhibitor. The ACE inhibitor, angioedema, cough, electrolyte problem, that's hyperkalemia, and you can use, I use a teratogene, and there's a teratogenic, and all, you can substitute ARB if they have a cough. So that's my side effect. Let me look at the answer. Having penicillin allergy, it does not correlate to that. Does not like banana, excellent. Your potassium is going to go up anyway, so if you hate banana, we're good. Does not use salt substitute. Salt substitute is mostly potassium salt. So if they don't eat salt substitute, that means the potassium will be fine. Prior miscarriage, they've had a baby, but has misfortunate, so lost the baby. It does not do anything, but it's a distractor. I put it there as a distractor. The last menstrual period was 2 months ago. She may be pregnant again. And when you're pregnant, you're taking a ACE inhibitor, you call agenesis of the kidney. So renal agenesis. So this because it's a teratogenic. So because of that, we need to have a pause. So this is your problem. Okay. Number 7. Select or apply. Pick those you're confident. This, you don't lose a point. You don't want to lose a point. So if I'm 99.9% sure, I'm picking 1. If there's 2, I'm picking 3. Whatever it is. But you got to read the question. Select or apply. Which of the following need immediate intervention? So you underline, I need to, my axe is being, find something I need immediate intervention. Okay? That means something is wrong, I got to intervene. A client is on the Med-Surg unit for newly diagnosed, I see measles here. So we have a measles problem, and I need immediate intervention. Then you break the question down. Patient who has measles, and I need to intervene. Measles, what is that? Is it contact? Is it droplet? Is it airborne? This is the way you should do infectious disease. This simple. Then you look at it, it's not contact, it's not droplet, it's airborne. What do you need for airborne? N95. For who? The nurse. Patient, none, unless they're going to get X-ray or they live in the room, they use surgical masks. The room door is closed, okay? And you go through a side door. You don't go through the main door. Change and go to the patient room. Keep your mask on when you come out until you complete it out and you take it out. Client in the private room. So let's look at it. Private room, that room should be what? Negative pressure. Okay? So a client in a positive pressure room. Read, when you're taking the test, read every word in the answer choice. Room is good, pressure is good, client is in something, but that something is not positive. It should be negative pressure. So this is what? Need immediate intervention. We got to intervene here. We should put them in a negative pressure room. Next, wear surgical mask during routine care. Routine care is good for the patient, but what did the nurse do? Wear surgical mask. She's going to get sick. She needs to wear N95. So what do? Which of the following need immediate intervention? This one. Client wear N95 in the room. Client does not wear anything in the room. So which need immediate intervention? This one. Client door closed all the time. That's excellent. Client in the private room. That's excellent. So which one need immediate intervention? It's 1, 2, 3. It's a select or apply. New generation. This will be plus minus exam. If you only know 2, pick 2. If you only need 1, you get 1 out of 3. It's better than none. If you pick all 3, that is, you pick all 5, you end up having what? 2 wrong, so you get 1 point. So whichever way you want to go, but the strategy is don't pick until you're 99.9% sure. Okay. So that's 7. Number 8. Select or apply, the same thing. The family want to know the changes their relative will go through. What is the issue? And nurse is caring for a palliative client patient on a palliative care unit. So we have a palliative client. And then family want to know what will happen. What will happen to their client? You have to understand the word palliative. Palliative, so people get sick, they have terminal disease, we cannot fix it, so they will eventually die. But what kind of death do you want? Is it painful or peaceful? Palliative is a form of peaceful death. All we care about is quality of life. Quality of life, that's the word here. And we manage your pain associated with the problem, not that we don't fix the problem. So the problem is not curative. We're not curing you anymore. There is no curative intent. The idea is to provide quality of life and no curative intent so that you can have a peaceful life and control your symptoms control, but no curing it. If you're going to live less than 6 months, we send you to hospice, less than 6 months hospice, so that you can go to a place you can die peacefully. We don't cause any harm. Therefore, your relative will be restless is wrong. Your relative will have a lower heart rate is wrong. Your relative will have a cold extremities is not. It's all comfort care. You have symptoms control therapy, excellent. You will transition to hospice if it's less than 6 months to live, yes. You have therapy focused on quality of life, yes. You have curative intent of medical problem, no. Your problem is not going to be curative. We are not curing you, unfortunately. So what you tell them, the nurse want to know the changes their relative will go through, select or apply is 4, 5, and 6. This is what they will go through. Okay, that's palliative care for you. Number 9, my favorite question. What is the next priority action? I like priority. That is medicine. Make you think. A client with MI diagnosed 3 days ago, now with a heart rate of what? 115, blood pressure of this, CVP of this, shortness of breath of that. I've given you everything. So let's break down the question. MI. When I do this, I want you to do the same thing when you answer the question. I have MI. All of a sudden, 3 days, my heart rate is up. My blood pressure is down. My CVP is up. And I have shortness of breath. This is your heart. Your lung is here. And you have superior vena cava, inferior vena cava. You have a heart attack here. So this muscle is dying. All of a sudden, what happened? Your lung is in trouble. That means something is coming here. The lung cannot give the heart anything anymore. So there's a buildup fluid. Go to the left portion. You come to the right portion. And then you have CVP. That is a CVP going up. That's equivalent to JVD. So if I have JVD, I have a heart failure. If I have a shortness of breath, I have a lung problem. This is cardiogenic shock. And I have what? Systemic issue. My blood pressure is going down. So this patient is in cardiogenic shock. How would you treat them? Getting EKG will not give you any more information than I've told you. Nitroglyceride, yeah, it will decrease the preload and afterload. That's because it's a venodilator. Preload, afterload. But you need something to pump the heart. So you need to do vasopressin here. So you have to have nitroglyceride and vasopressin. We just have nitroglyceride. If you give them fluid, you're killing them. You're drowning them more from the shortness of breath. So what pushes the heart is agonist, okay? Something that can push the heart, ionotrope. So we need an ionotrope to push the heart to pump, and that is dibutramine. This is the favorite one. Okay, so dibutramine is your choice of medication to give. And the last one, select or apply, of course. A patient with nocal rigidity, fever, headache, neck stiffness due to bacteria, which precaution technique is appropriate? Break it down. It's a SATA question. Pick those you're confident, right? If I have nocturnal rigidity 1, fever, headache, and neck stiffness, something should be ringing in your head. Caused by bacteria, this is meningitis, right? What precaution do you give to meningitis? Is it contact, airborne, or droplet? I know it's not contact. I know it's not airborne. It's droplet. What do you do for droplet? Surgical mask when you are in 3 feet of the patient. The door may be closed, right? And the patient in private room if you can. Wear a gown before entering the client room. It said which precaution is appropriate. It's not appropriate. Wear a gown if it's a contact problem. Wear surgical mask when entering the client room. Yes. Patient in the negative pressure room, they don't need any negative pressure, regular room. So this should be room. They need regular room. Patient in private room, yeah, that's fine. Patient door is closed, so that's fine. So 2, 4, and 5. Door closed, private room, and wear surgical mask. This is the end of it. Good 10 questions span several areas to stimulate your mind. As always, try to challenge you, solving questions using content. All the best of luck if you stick around and subscribe for more content like that. And God be with you. Amen.